watching the award-winning GHS-TV, Germantown Community Television, your hometown news and information station. Welcome to another edition of Germantown Community Television's award-winning Access Together series. Informative, educational, and entertaining, our diverse programming lineup offers something unique for every viewer. Whether you want to keep up with the latest community news or learn how changes in the Mid-South and beyond affect us right here at home, these local programs keep the focus on you, the citizens of Germantown. Each show is hosted by a member of the community and produced using the students and facilities of Germantown High School's nationally renowned television station, GHS-TV. These programs are made possible through the combined efforts of the City of Germantown, Shelby County Schools, GHS-TV, and the Germantown Community Television Foundation. If you have any questions, comments, or program ideas, write us at the address on your screen or call 754-4788. You can also email us at ghstv17@aol.com. For more information about GHS-TV and our programming, visit us on the web at www.ghstv.org. Thanks for watching, and we hope you enjoy the following presentation.
Welcome to Chamber Matters. I'm your host, Pat Scroggs, President and CEO of the Germantown Area Chamber of Commerce. During each show, we will take an inside look at the business leaders making a difference in our city. The Germantown Area Chamber of Commerce has existed for more than 39 years. Our staff, board of directors, ambassadors, and volunteers are all dedicated to creating a vibrant business environment through interactive partnerships with business, government, and community. Today in our Business Leaders segment, we are going to meet Debbie Edelson, CEO at the Stern Cardiovascular Foundation. And in our Difference Makers segment, we will talk to Catherine Black, Community Representative for Bradford Health Services. And in our Up Next segment, we will discuss with Nicholas Mulnex, the Branch Manager Assistant VP with Trustmark Bank, the Chamber's Young Professional Group. All of these dedicated volunteer leaders are involved with ongoing activities of the Chamber. Joining us now is Debbie Edelson, CEO with Stern Cardiovascular Foundation. Thanks, Debbie.
Thank you.
I know there's been a lot of changes over the last few years, and earlier years you were my guest when it was the Stern Cardiovascular Center, and now it's the foundation. So tell me about some of the changes in the last several years.
Well, in January of 2011, we formed a strategic partnership alignment with Baptist Hospital here in Memphis and also in DeSoto, since we have offices there as well. And basically it was a reaction for us. We had a vision and wanted to maintain our vision and to continue on where we thought we wanted to be with healthcare reform and other initiatives. We were kind of reacting to the environment and decided, you know what, we would be a lot stronger and be able to meet all of the initiatives and be more proactive in our patient care and our commitment to the community by having a partnership with a healthcare system such as Baptist. So we're very honored to have that partnership, and it went fairly quickly and fairly well so far. So we've just made our first year with them.
Well, congratulations on
Thank
that.
you.
And well, has your vision or your mission changed since you've formed this foundation with Baptist?
Our vision is very similar, which we discovered with Baptist. We both have a similar vision, so we've now just been able to expand on that vision of patient care, patient access, quality initiatives, but we did realize that possibly we needed to have more of a physician base than just 17 docs. So in March of 2012, we merged with Memphis Heart Clinic. So now, from January of 2011 to March of 2012, we went from 17 physicians strong to 34 physicians, even stronger for the community.
Well, with the foundation, in what areas do you plan to educate the public, or continue to, I should say, about heart disease?
Well, with healthcare reform, one of the biggest initiatives for that is patient-centered care, meaning that patients have access to care regardless of insurance. patients have access to services. Quality initiatives are very important. We've partnered with the hospital and already have 2 big initiatives going for congestive heart failure patient readmissions, as well as low-risk chest pain. The goal is to try and help keep the patients from having any crisis and to help keep the patients out of the hospital system so that the care they get is continuous and maintain the quality. One thing that Stern has always prided themselves on has been about the quality care and having the patient access, that there is access for them. We have many, many locations, and we're able to provide that through our alliance with Baptist as well.
Right. It's my understanding, are you planning to consolidate the various locations, or what are your plans?
That's a little bit of the challenge. Logistically, there's 2 big locations now in Memphis. There's 2 big locations in Mississippi, 1 in Munford, Tennessee, and then we do a host of outreach locations from New Albany, Mississippi, and Oxford area, all the way to Union City, Tennessee. So we're happy to do all of that, but we do need to get some consolidation. But you know, you don't want to logistically move out of an area where patients are used to being able to have their care. So we're taking that into consideration. But for efficiency and better utilization of all of our resources, I think we'll end up with like 1.5 in Memphis and 1 big physician office and maybe 1 testing center in Mississippi, and still continue with all of our outreach programs.
Right. Well, on another congratulatory note, I know that you were named one of the top 25 super women in business with the Memphis Business Journal recently. So we're so proud of you, and
Thank you.
We take pride in your honor by being
it's a huge honor, yes.
A chamber member and one of our corporate sponsors. But what is your role actually in keeping Stern a place that people can trust and take care of us and our families for the future?
Well, the patient comes first for Stern, and it always has, and Memphis Heart had that same goal. So our goals there are very much aligned and attuned to each other. So for my role, it's overseeing the entire operation from the 34 physicians to we employ 300 plus staff members. So for me, it's a day-to-day of managing that and making sure that we're taking those steps and fulfilling those goals in reaching all of the vision that we've seen and that we are actively working on. We have a lot of physician involvement in reaching the goals that we want to, and it's very rewarding for the staff and the physicians.
Absolutely, with a good leader for sure. Well, tell me about, again, the future as far as the foundation and medicine in general, and of course we know about the health care reform laws, and how does that affect Stern as well as the patients?
Well, like you said before, it's about education and access. So we do lipid clinics, and we do vascular screening, and we now have rehab. Through our partnership, Baptist put rehab in the Stern building in Germantown, which is wonderful. It's easy access for the patients. It's drive right up, they just get out. There's a nice area for the families to wait, so that's been very successful. We continually try to give education to the community as well as to our patients about lipid clinic, Coumadin clinic, pacemaker device clinics, those kind of things. We were able to, with backing from Baptist, have huge marketing initiatives that really reach out to outlying areas that before maybe we weren't able to reach. So I think for Stern and for Baptist together, just being able to be out there and reach the patients that we didn't reach before and offer those services in their own communities is going to be key in moving forward.
Just have another few minutes, minute I should say, how does one make an appointment at Stern, and do they have to be referred by another physician?
Absolutely not. You don't have to be referred. It's at 271-1000 is our main number. We do centralized appointments. You can be seen at any clinic with any physician at any time.
And what about Facebook
page? We do some of that social media. I'm not real sure we're into Twitter yet, but we all learned about the Facebook, and we do have a Facebook page, and we put a lot of information out there. We have our own website that we put a lot of information out on, and we're getting ready to open up a patient portal to where you'd be able to do online appointments, online registration, those kind of things.
Right.
So we're trying to stay progressive and be proactive rather than reactive.
Right.
So
thank you so much, Debbie, for
you.
being on our show, and we wish you all the best and success in the future with Stern Cardiovascular Foundation.
Thank you very much.
Thank you. We're going to pause for a short break. When we return, we will talk with Catherine Black with Bradford Health Services.
watched it over the span of 3 decades. We've dedicated ourselves to making it a fantastic community show, and the Alliance for Community Media has named GHS-TV's Crosstalk the best informational program in the country. From coverage of important area issues and events to conversations with high-profile local, national, and international personalities, Crosstalk keeps you informed and entertained. Don't miss Crosstalk, produced entirely by the students of Germantown High School. The news show airs each week only on Germantown Community Television, cable channel 17.
Hi, I'm Mia Hamm. As a professional soccer player, I know how rewarding sports can be and how quickly injuries happen. So I've teamed up with the American Association of Orthodontists to ask athletes to play it safe. With my years of training, I know what it takes to become an expert, and orthodontists do too. They're the experts who help people obtain healthy, beautiful smiles. Wear mouthguards, face masks, and helmets to prevent injuries. Keep smiling and visit braces.org.
You're watching the award-winning GHS TV, Germantown Community Television, your hometown news and information station.
Welcome back. Joining us is Catherine Black, Community Representative of Bradford Health Services. We're glad to have you today.
Well, thank you so much for having me.
And we're very pleased that Bradford is one of our chamber members and certainly do a lot of work. And of course, this is the Difference Maker segment. So we really feel like that certainly Bradford is making a difference and will continue to make a difference in our citizens' lives over the next years to come. But tell our viewers, what does Bradford do exactly?
Bradford has been in the profession of treating alcoholics and drug addicts for over 30 years. We are based out of Birmingham. We do have 2 inpatient facilities. One is right outside of Birmingham and one is in Madison, Alabama. In addition to those, we have over 25 satellite offices, such as the one that's new to Memphis, in 4 states. And what we will be doing here in Memphis is an intensive outpatient program for those patients who meet criteria for outpatient, which basically means that they would come to treatment either during the day or in the evenings and then return home. We also will be doing consults for families, family members who have a concern over a family member or perhaps teacher. Anybody who is concerned about another can call us to get some answers to their questions.
All right. Well, you mentioned coming to Memphis, but also specifically Germantown.
That's
and so
true.
how did Bradford choose to come to Germantown, Tennessee?
Well, the choice actually was made because it gives the Memphis market a different, another alternative to treatment for drugs and alcohol. The location we're in, we feel like is very convenient to this area of the city and East Memphis, Collierville, Cordova. It's a little bit easier access. We're right off of Farmington Road. And again, we just felt like this was, after much research, that this was the best place for us to be located.
What type of services do you actually provide?
What we do here in our office is that when someone calls in to Bradford, and the number is 755-8111, it's very easy to remember. Basically, we try to set up a time within 6 hours for that person, in addition to family, to come in to be evaluated by a clinician. And then at that point, it's determined whether or not this person would need medical detox. If so, we would refer them preferably to one of our treatment centers for the detox and following the residential service. We will be doing evening and daytime outpatient programs here in our office in Germantown.
Right. Well, is there a way to know if there are alcohol or drug problems in the homes?
There are some warning signs that research has shown to be very typical. Behaviors, things like tardiness to work, some isolating for an adult, obviously excess use of alcohol, sometimes perhaps money missing, general lethargy. With an adolescent, it can certainly be isolating, needing money for no explained reasons.
Right. Well, what would a person do if they suspected that there was a problem?
Now, they could call us at, again, 755-8111 and talk with one of our specialists and kind of explain the problem. Ideally, our clinician answering the phone would direct them to the appropriate resources. We actually have services available to the community in the form of what we refer to as a concerned persons group. And it's similar to what you or the public may know as Al-Anon, but it's not officially an Al-Anon meeting. It's more of a question and answer sharing of experiences.
Well, how is alcohol or drug problems different, let's say, from an adult versus a teen?
Okay. With a teen, typically alcohol and drug use is going to escalate much faster. Whereas with an adult, it's going to be a very progressive, perhaps more longevity before the crisis arises. However, with a teen, typically because the brain is still developing, the way the drugs and the alcohol enter into the body, the problem will escalate very, very quickly.
Interesting, and unfortunately, probably teens don't realize that
No,
necessarily.
typically not.
Yeah.
No.
What are the benefits of going away? For example, you hear about residential facilities and that type of thing. You want to talk about that just for a few minutes too,
Yes,
and about
sure.
how far away is yours, I guess?
Research again has shown that the longer a person can be stabilized in an environment away from their day-to-day life, such as their home or their work or school, the better their chances are of remaining abstinent and in sobriety. Basically, with Bradford in our residential facilities, it's a comprehensive continuum of care in that the person is given therapy for just a myriad of things. Not only the detox portion, but they would have individual counseling, group counseling, some trauma therapy if appropriate, educational, nutritional. It's a full spectrum of care, 24 hours a day in a very supportive environment because often in treatment, the patient finds that some of their greatest advocates are actually their peers or their fellow patients.
Right. Well, briefly, what if a person does not have health insurance?
Well, typically with us, we will certainly be delighted to go on and do a consult with the family, and we also would try to direct them to the appropriate resource because there are plenty of options available.
Right. Well, thank you, Catherine. I know there's so much information that could be said, and so thank you very much for being on our show.
Well, you're welcome. Thank you for having me.
Wish you the best.
Thank you.
We're going to take a break, but be sure to stay with us because when we return, we will discuss in our up next segment the Chamber's Young Professional Group with Nick Mullinex with Trustmark Bank.
Living in this crazy world, so caught up in the confusion, nothing is making sense for me and you. Maybe we can find a way, there's got to be solution, how to make a brighter day. What do we do? We've got to give a little love, have a little hope, make this world a little better, try a little more, harder than before.
Through innovative solutions, Child Fund is impacting children in need. With solar-powered lighting, allowing evening classes at a rural school in Kenya. By guiding youth to build energy-saving stoves in Uganda that reduce pollution and improve health. And by respectfully navigating complex local customs, Child Fund has created a girls' school in Kenya, providing an alternative to forced early marriage. Child Fund, innovative solutions, one child at a time.
Watching the award-winning GHS TV, Germantown Community Television, your hometown news and information station.
Welcome back. I'm your host, Pat Scroggs, and joining us is Nick Nemolinex, the branch manager and assistant VP at Trustmark Bank, and he's here to discuss the Chamber's Young Professional Group. Welcome, Nick.
Thanks, Ms. Pat.
With your title and what you're doing for the Chamber, there's a lot of words there, but thank you for representing the group today.
Yes,
and telling us about our Chamber's new Young Professionals Group. So would you like to tell us a little bit about it?
Yeah, it's a new group that started at the first of the year along with the Chamber of Commerce. It's a group of those between 22 and 40 that are members within the Chamber looking for another avenue to get involved.
Well, that's a good answer, short and sweet. Well, how did it actually get started, and what is the purpose of this group?
It was actually started as a direction by the Board of Directors with the Chamber of Commerce. They were trying to find a way to, for lack of a better term, tap into the group between that age of 22 and 40. They felt like that was where we were going to find the next leaders, the next chairman, the next board of director members possibly, and we had an informative luncheon actually at the chamber office, had around 35 people sign up that day, and it just kind of blossomed from there. So.
Right. Well, I understand that there are committees that are now have been formed, and you want to discuss that a little bit too?
Yes, ma'am. We currently have 6, everything from membership involvement, development, social network. We're on Facebook, as everyone these days has a Facebook page. We felt like that was going to be one of the prominent ways for us to reach out to this group because that age demographic focuses so heavily on the social networking, professional development, activities, as well as community involvement. And
so what have been some of the activities that have already happened this year and that type of thing? Currently, we've had 5 mixers. The first one was at Elfo's, which was sponsored by Wolf River Management. And at each of our mixers, we actually have them, obviously, are hosted by an organization. And then someone comes in, either the current organization to take care of the food and drink, or we ask another community partner to come in and help us. So, as I said, we've had them at Elfo's, Take Home Gourmet, the Esplanade, the Reserve at Dexter Lake, and recently at GPAC. Right, and I know that there's great plans for the remainder of the year too that sound very exciting. And it's so good for these businesses to have the younger generation to come to their business too, to understand exactly what they do. Well, other activities that are planned, I know I think there was a young, development program that was held actually at your bank. Yes, ma'am. We quarterly are having what we're calling like a lunch and learn, where we're having not only food brought in for lunch, but also having an informative discussion. The first one was with Jackie Taylor with Union University. She did a discussion on diversity in the workplace. We're actually planning, obviously, for the coming year, several others as we come down the pipeline. But that was the piece that we really wanted for the members to get something out of. The networking pieces are where we get together, exchange business cards, and find out how we can help each other. And the professional development piece was really set up as a way for us to come and listen and find out ways that we can grow as professionals. Right. Well, as a new group to our chamber, what are your goals and plans for the future? We would like this group to grow exponentially, and I say that we're currently up to around 80 members. So from the beginning of the year, started at 35, we're up to 80. We also are going to be putting together a formal board as well as a group that was going to follow how proper meeting and protocol should go. We have now grown to the point that we feel like it's time to take the group in that direction. That's so wonderful. Well, how can one become a member and how do they join? It's actually very easy. The really only requirement is to be a member of the Germantown Chamber of Commerce. Got to be young. You do, 22 to 40. And believe it or not, I've had a lot of over 40 people want to know, can I be in that group? They sound like they're having so much fun. Well, we always joke and say that we're not going to check ID. Exactly. But, you know, it is 22 to 40. Yeah. There is currently no fee to be a part of it. We actually have been very fortunate that members of the community have donated the time and the places and the food. So to be a member, you just really have to sign up through the Chamber of Commerce. Right. Well, how can the Germantown community get involved with the YPs, as we're calling them? Well, the success of this group, I think, largely depends on the community itself.
Right now, currently, we are needing places to have the mixers. It's a monthly. If you have a spot, it's just the commitment of the space. You don't necessarily have to commit to the food and beverage. If you would like to do that, obviously, that helps us out as well. And then for our professional development seminars, anyone that would be willing to host that event, as well as if we have somebody that wants to be a speaker. Right.
Well, by also forming the YPs, how does the group want to help and support the community?
Well, currently, since the beginning or the inception, we picked out Literacy Mid-South as our community partner. And at each of our mixers, we have asked each of the YP members to bring a new book or school supplies, because we feel like not only do we want to obviously better ourselves in our own professional and personal lives, but we like to have some type of philanthropy aspect to it as well. We've also had Girls Inc. come and speak to our committee chairs on ways that we can plug in and help them as well.
All right. So I assume everyone is excited. We just got a few more seconds here, but anything else that you'd like to add? Would you like to give your information, how they can contact you when they're watching the show?
Certainly. You can contact me directly at Trustmark National Bank right at Briarbrook and Germantown Road. My number is 901-758-8811. You can just call and ask to speak with Nick, or you can actually contact the Chamber of Commerce. They've got all the information as well as the Facebook page and website.
Right. And Facebook website, you just go to the chamber and then click on to the Young Peas.
Yes, ma'am. Okay. It's all connected right there.
Right. I got it. Thank you so much, Nick,
and
thank you for participating and helping lead this group, and we look forward to the future.
Yes, ma'am. Thank you.
Thank you for being with us today for Chamber Matters. We appreciate our guests on today's show, Debbie Edelson, Catherine Black, and Nick Mullinex. If you have questions about this or any other show on Germantown Community Television, or if you'd like to watch our live stream, visit ghstv.org. You can also follow the station on Facebook and Twitter. Thanks again for watching, and see you next time on Chamber Matters.